News tonight at 5. A mass shooting at a Tennessee grocery, leaving at least 14 victims. One person is dead. 13 more are hurt. Police say the shooter is also dead.
It happened this afternoon at a Kroger grocery store in suburban Memphis. Police worked to clear the store, finding victims as well as frightened employees and customers.
I know we found people hiding in freezers and in locked offices, and they were doing what they had been trained to do: run, hide, fight. The shooter is deceased. We believe that's going to be from a self-inflicted gunshot wound.
The investigation is still ongoing tonight, and so far police have said little about the shooter. You can look for continuing coverage of the situation here on KGW, on air and online. NBC Nightly News will also have the latest coming up at 5:30.
Now to gun violence here at home and a record pace of shootings this year. Yesterday, a 9-year-old girl begged the city council to find a solution after she and her family ran from gunfire in a Portland park.
And today, leaders with Multnomah County vowed to step up and invest millions. They're also concerned we need more police in Portland. Here's Maggie Vespa.
This is a crisis. Our community deserves safety.
Shootings have been surging in Portland since early 2020, and this year is on track to set another new record. We've had 917 shootings so far this year, up from less than 400 in 2019. Portland city officials have promised repeatedly to find a solution. Thursday, it was the county's turn.
We haven't heard as much from what Multnomah County is doing, and we want the community to know that we're working together.
Calling for all hands on deck, Multnomah County's chair, sheriff, even the health department director vowed to invest millions to help stop the shootings. First up, the district attorney's office.
For many of the prosecutors in my office have been doing this for 20 or 30 years. Once in a career surge in this in violence crime.
Multnomah County is vowing to invest $1 million into hiring 4 new prosecutors and 2 new investigators. They'll help handle the overwhelming workload that is responding to homicides and prosecuting killers.
In just this year, in the first 8 months of this year alone, they've made 285 gun-related prosecutions, which is probably more than we've made in the last several years combined.
The county's also investing $2.8 million into public health programs, including a behavioral health response team of 7 mental health professionals who will respond to shooting scenes.
They're going to be in the field. They will be at the scene. They will be in the hospitals.
The plan, leaders hope, will strike a balance between short and long-term solutions. But they admitted change won't come quickly, which they know is what Portlanders want.
It was my turn to bat when I saw them pull out guns and start shooting.
Wednesday, 9-year-old Hadar Kadem stopped a Portland City Council meeting in its tracks with her harrowing story of running from gunfire in Rose City Park.
I want to feel safe.
Her speech accompanied something of a policy pivot for the city. In the last couple of weeks, Portland Mayor Ted Wheeler and Commissioner Mingus Mapps both publicly said they'll work to beef up the ranks in the city's police bureau.
I feel highly accountable for community safety. That's
this roughly 1 year after both voted to slash millions from PPB's budget. Since last summer, close to 150 officers have left the bureau, many frustrated by those cuts. Thursday, KGW asked county leaders if they agree the city needs to hire more police officers to get gun violence under control.
I believe the Portland Police Bureau is understaffed. They're under-resourced. They don't have enough officers to respond to all of the events that are happening in their community. They don't have enough.
Maggie Vespa, KGW News.
Vancouver police think they've found the person responsible for snatching multiple purses over the last few weeks. 2 14-year-old boys are now in custody. The latest incident was on Vancouver's waterfront outside of a coffee shop. A woman told police someone stole her purse from a chair where she was sitting and took off in a car. Police found the teenagers in that car. Another woman, who requested we don't show her face, said the same thing happened to her last week at the waterfront.
Said, "Excuse me, ma'am," and then reached over and grabbed my purse. As he was attempting to flee with it, I got a hand on it, but he got the better of me and jumped in that same car that I'd seen before, and they took off.
She says the thief racked up a $2,000 bill on her credit card. Vancouver police are looking to see if this case is connected to the other one. They say additional charges are pending.
With kids back to school, there's an increased concern about COVID spread in the classroom. The latest weekly report from the state shows 750 new cases in elementary kids, with 2 in the hospital. For some parents, quarantining and testing of students is frustrating and confusing. Christine Pitawanich has more.
Right now, with school in full swing, a lot of parents are talking about COVID-19 testing. This week, Portland Public Schools started distributing consent forms for parents to opt in to weekly COVID-19 screen testing for their kids. Next week, the first batch of forms will be sent to OHSU. Then students whose families opted in are expected to get test kits in early October. Other area districts are working on similar plans.
My name is Corey Fish. I am a pediatrician and the chief medical officer at Brave Care.
Dr. Corey Fish says there are a number of factors behind the push to test kids for COVID.
The first one is that, the jury's still a little bit out with Delta. I think still the question hasn't been definitively answered about kids and are kids more susceptible. But what we're seeing without question is that there are more kids being affected, whether that's just because there's more cases overall or because it's, specifically worse for kids. I think people are still trying to wrap their head around it to figure out.
Another reason, simply because earlier in the pandemic, kids were at home. Now many are back in school. And of course, we're also approaching cold and flu season.
Unfortunately, there's just no great way in kids to tell the difference between COVID and now that we're getting into respiratory season with influenza and RSV and all of these other things that we see normally this time of year.
Ultimately, Fish hopes once a vaccine is approved for kids 5 to 11 years old, parents will decide to get it for their children.
1 in 20 kids who end up in the hospital with coronavirus will have very serious and potentially permanent neurologic complications. So it's if that's not enough motivation for folks to get the vaccine, I'm not sure what is.
Christine Pitawanich, KGW News.
New numbers from the Oregon Health Authority show breakthrough cases appear to be increasing. From September 12th through the 18th, 23.2% of COVID cases in Oregon were people who are vaccinated. The week before that, the rate was 18.7%, and in mid-August, it was about 12%. But that being said, the overwhelming majority of COVID cases in Oregon are still people who are unvaccinated. Breakthrough cases are also rarely requiring hospitalization.
New today, a CDC advisory panel is backing Pfizer's COVID vaccine booster shot for certain Americans. This includes those 65 and older, people living in nursing homes, as well as younger people with underlying conditions. The panel will still vote on whether to recommend boosters for people with higher risk of virus exposure. The CDC could give final approval for the booster as early as tonight.
A growing problem in the pandemic, one we've covered extensively in the past few weeks. Oregon hospitals are having to delay surgeries because of a lack of staff and a surge in COVID patients. Sandra Ramirez of Shady Cove in Southern Oregon says her husband, John, needed a serious heart procedure at Providence in Portland. Problem is, there were no hospital beds available, and the couple had to wait for several days. During that time, John's condition got worse. He ended up having to be life-flighted to Portland. By the time he got there, they learned John needed open heart surgery instead of just the stent that he originally had planned. Still, Sandra says she feels lucky that John was able to eventually get his procedure.
I feel so sorry for the people who didn't get in and who need surgeries and they can't get in. That's got to be heartbreaking to know you've got cancer and you can't get rid of it.
She expects her husband to come home today, actually. She strongly urges people to get vaccinated and says it's frustrating that the unvaccinated COVID patients are making it difficult for others to get care.
In Washington today, Governor Jay Inslee extended the state's eviction moratorium for 1 month. It was set to expire a week from now. The governor says 80,000 renters and landlords need more time to get federal funding to pay off those rents that have not been paid, in some cases since March of 2020. More than $500 million in federal assistance is on its way, but the governor says the feds have not been able to make that money available to counties yet.
We believe that streamlining has already taken place and will dramatically accelerate the distribution of funds. And that's very, very important. And in our discussions with local leaders, they do believe by the end of October, we'll be in good shape.
The moratorium now lasts until October 30th.
U.S. athletes gearing up for next year's Winter Olympics will need to get a COVID vaccine. Team USA just made the announcement athletes will need to show proof of vaccination by December 1st. Prior to the Tokyo Summer Games, vaccination was encouraged, but it was not required. The U.S. plans to send about 240 athletes to next year's Winter Olympics in Beijing.
It is move-in day at the University of Oregon, and it's been a bit of a headache in Eugene. All the students heading to the dorms caused big traffic jams. Almost 3,000 students were checked into their rooms today. It's the university's single biggest move-in day. Students also have staggered check-in times as a COVID precaution. Jams were largely caused by students arriving earlier than scheduled. The U of O is also requiring COVID vaccines for students and staff or a qualifying exemption. Classes start Monday.
That's what you get for trying to show up early, huh? It was also move-in day for the freshmen at Portland State University. About 1,700 freshmen will, throughout the next couple of days before school starts on Monday, start to move in. Students must be vaccinated against COVID-19 unless they have an exemption. For some, it'll be the first time in a classroom in more than a year.
Personally, me, it's induced a little bit of anxiety, but everyone here is so kind.
So it's definitely going to be a shock getting back into class next to people, especially now that COVID still isn't, as, it's still bad. So it's kind of concerning in that way, but I'm just happy to be in class.
There are about 500 fewer students moving into the dorms than during a normal year. The school has reserved a few floors to be used as isolation floors should a student test positive.